Very good evening, friends. Meeting again in the session of Madra Medica. And today we're going to learn one of the polycrest, that is the petroleum, a very deep acting remedy and very useful in day-to-day practice. So we're going to learn about this remedy. I'm going to share first two cases and thereafter we'll learn it from Allen's keynotes. Okay, so we'll start. So it was a way back. This patient, in fact, the patient was very close to me, and that lady, she came to me for one problem. She had a very severe traveler sickness. And she said, is there any remedy in homeopathy, doctor? I could not tolerate, even whenever I take the avomine tablet, I get tremendously drowsy and I used to vomit even after taking that. Then I get a headache and I could not control. And many medicines have been tried on me, but it is not working. And that's why I never goes anywhere. I tries to avoid going anywhere. Even for a small distance, even 20 to 30 kilometers, I cannot travel in the bus, in the car. Only on two-wheelers I can travel. The problem is that whenever I used to sit in a car or anywhere, I start feeling nausea. I start feeling the vomiting. And I have to consume something continuously. I go on eating something every 10 minutes, 15 minutes, I have to take something. Then and then my nausea gets settled, my pain in stomach gets settled, the vomiting stops. And throughout, if I am going from Sangamner to Mumbai, I used to continuously, I have food bag. I used to continuously, every 10, 15 minutes, I used to put something in my mouth and I have to consume that. Then and then only I feel better. Otherwise, it is a very difficult task for me to go to the Mumbai. So this is a big modality where we can differentiate a remedy for travel sickness. Otherwise, the common remedy we used to think about the cocculus in many times. But here, the modality is that patient wants to consume something continuously, then and then her gastralgia, her nausea, her vomiting, the traveler sickness settles. This is petroleum. So I have given her petroleum 30 for 3 to 4 days, tedious. I said, you consume this and then no more medicine is required, and you tell me what happens if you are going anywhere. She said, day after tomorrow I have to go to Mumbai, and that's why actually I am here. So I don't know whether homeopathy will help me, and for that purpose she was there with me. So I said, let us start with this and tell me your experience. So I asked when you will be returning back. And she said, I will be returning back after a week. And after a week, when she returned, next day she visited me. And she told, doctor, this is first time I never felt anything. First time I have traveled without continuously eating. I never had a nausea. I never had a pain in stomach. I never had a vomiting sensation. I was happy and I was enjoying my traveling. So it was a wonderful experience for me with the petroleum. That was the first experience with petroleum I have utilized with the specific modality, and it works so beautifully in that case. So that was first case. And in second case, it was the case of palmar eczema. So she has a palmar eczema as well as plantar eczema, but where she used to suffer from the cracks on the hands and feet with tremendous thickness of the skin, and it was tremendously itchy. And it used to get aggravated only during winter. That was her problem. Someone have told her that it might be a psoriasis, but it was typical eczema, not psoriasis. And it used to happen every year, every winter. And she said it is there since last 6 to 7 years. So I observed her eruptions on the palms as well as so. And characteristic was that at the tip of the fingers as well as tip of the toes, she had cracks over there and they were so painful. Second modality was it used to happen every winter. Third important modality was that she was absolutely chilly patient. And fourth important thing, she said, doctor, during summer, you'll find that as if there was nothing. It used to get recovered completely during summer season. So eczema is the worst thing to be treated in homeopathy because it takes long time to get recovered. So I have considered, let us try with the petroleum because this whatever she is telling is completely petroleum. So I have started her on petroleum. Again, I have utilized same potency, petroleum 30. I have given for 3-4 days. Petroleum, generally I used to use in repeated doses for at least 3 to 4 days, even though it is a very defecting remedy. Because it requires little bit stimulation to get its action. And that's why I used to use it 3-4 days and then I used to stop. So same method I have followed with that patient and asked her to meet me after 15 days. When she returned after 15 days, she felt that itching was much less. Her cracks were healing. So I have kept her again on placebo for next 15 days. Again, after 15 days, more more than 50% recovery was there and it was healing and her itching was completely disappeared. And basically, the tip of the fingers getting cleared. So I have utilized the remedy during winter only and it was working. So I have continued her with the same placebo for another month and she recovered during the whole process. And thereafter, once she had a recurrence, then I have shifted her to the 200 and one dose of 200 worked beautifully, recovered the whole case. So it is a very good remedy for palmar eczema, plantar eczema, and where the cracks are characteristics and cracks at the tip of the fingers, the eruptions gets aggravated during winter season and ameliorated during the summer season. And tips are specifically gets affected in petroleum. Another remedy which comes closer is graphitis, but in graphitis it is VP eczema. In case of petroleum, it is dry eczema. That is the basic difference between the two remedies over there. So these are the cases, simple cases, but generally if we learn the cases, then we can learn a lot regarding the remedy. Let us go with the Allen's keynotes, petroleum, coal or rock oil, anthracite. Adapted to the persons with light hair and irritable, quarrelsome disposition. This remedy is very close to the at the sensitivity level, it is very close to the Nux vomica. Very close. They are quite irritable, they are quite sensitive, they are quite quarrelsome, easily offended, very easily offended at very trifles, very minute things, they get affected. So something happens and they get disturbed. It looks ignatia, it looks like natramure, it looks like medorinum. These are the remedies which comes closer, very offended easily, vexed at everything. The anger which happens to be there is of a higher quality, higher degree. Vexation is the highest degree. Triples on very small things that shows the vexedness, everything. Elements from riding in a carriage. That means whenever they go with for traveling with car or anything, railroad, car or in a ship, there is always a problem. Cocculus, sanicula, these are two more remedies, but cocculus is very commonly used for that purpose, but this is the remedy, petroleum, where you get that typical modality which I have told you. Elements are worse, which are worse before and during thunderstorm. This is one characteristic one should not forget, close to the phosphorus. Very close to phosphorus. Natrum car, phosphorus, and soranum. These are three remedies. Symptoms appear and disappear rapidly, very close to the belladonna, where symptoms appears and disappears very suddenly, belladonna, MacPath. And reverse of platina and sternum means in platina and sternum, symptoms appear gradually and disappear gradually. It takes long time. So platina and sternum are not the remedies for acute ailments. They are the remedies for chronic pathologies. Because the things never happens within a day in platina. They never happens within few hours in sternum. During sleep or delirium, imagine that one leg is double. There are many delirious symptoms. They feel that there is one leg which is double, then there is someone who is lying along with that. So another person lies alongside with him in the same bed. That another delirium is that there are two babies in the bed, like Valeriana. So there are many, many delirious states you can get in petroleum. Vertigo on rising very close to the bryonia. Vertigo in occiput. So vertigo happens to be there in occiput region, as if intoxicated, as if he has drunk anything, as if he has taken any drugs or any alcohol. Vertigo like seasickness, very close to cocculus. These two remedies are very close at this level. So there is a vertigo after traveling, after riding in a carriage, after riding in a ship. They get this vertigo because of carriage riding. See, the next feature, very important, is headache. And again, the location is very important. Headache in occiput, vertigo is also in occiput, which is as heavy as lead. So head feels tremendously heavy, as if like a heavy lead. Headache is pressing, headache is pulsating pain, as if everything in the head were alive. Headache with numb bruise sensation, headache as if made of wood. So there are multiple sensations, but basically it is heaviness in the occiput, as if a lead or wood. It's very characteristic of petroleum. Gastralgia. This gastralgia is generally happens to be there because of carriage riding. Gastralgia of pregnancy with pressing, drawing pains. Whenever stomach is empty, relieved by constant eating. Underline this. This stomach symptoms are always better by constant eating. That is very, very important feature of this remedy. सर लेक्चर चालू आहे 10 मिनिटात फोन कर थोडा डायरिया येलो watery gushing after cabbage, diarrhea of sauerkraut, diarrhea during pregnancy, diarrhea by stormy weather, diarrhea always in a daytime. So very characteristic modalities, yellow, it is watery, it is gushing, diarrhea after eating the cabbage, diarrhea after eating sauerkraut, diarrhea during pregnancy. So there is gastralgia during pregnancy, diarrhea during pregnancy, headache during pregnancy. There are many features during pregnancy. Diarrhea during stormy weather, diarrhea always in a daytime. Very typical features which you can get over there. Petroleum, then another feature is that painful sensitiveness of the skin of the whole body. So skin is too sensitive. It is painful. All clothing is painful. So something touches the body, it is painful. Slight injury suppurates. It is close to the sulfur, it is close to the silicia, it is close to the hepar sulfuricum, it is close to the arnica. Skin of the hands are rough, cracked. Tips of the fingers, rough and cracked. See, tips of the fingers, it is given in italics, rough and cracked. Skin is fissured every winter. Tenderness of the feet, which are bathed in foul smelling sweat. Graphitis, sanicula, silicia. Three remedies are there. First is graphitis, second is silica, and another is sanicula. Foul smelling sweat. Very characteristic of all three remedies and four remedy. Fourth is petroleum. This is one more feature where one should not forget. Just 8 days back, I have treated one case of a herpes of genitals. The young fellow, 32 years of age, came to me with this herpes of genitals, and it was along the genital, along the perineal area, and it was very much painful, burning, and there was tremendous itching. Whenever it happens to be genitals, it used to produce more trouble. So this is wonderful remedy to be utilized. This season is there, Rustox is one more remedy, and if eruptions are more of a dry character or sometimes some pustular character, this remedy petroleum is also important. Herpes of genital organs extending to perineum and thighs, herpes with itching, redness, herpes where the skin is cracked, rough, bleeding, herpes with dry or moist. Both, you can get the dry eruption, sometimes moist eruption. Heat and burning soles of the feet, palm and palms of hands, like sanguinaria sulfa. Sweat and moisture of external genitals in both sexes. So there is a tremendous sweating and moisture around genital. Painful itching chilblains, very important remedy for tinea pedis, specifically in rainy seasons or those who used to work in field. If they get the chilblains, this is very important remedy. Painful itching chilblains and chapped hands, aggravated in cold weather, it is a very good remedy for bed sores, decubitus in bed sores. Sensation of coldness about the heart, that is a sensation. Patient feels there is a coldness around the heart, like carboanamylase, like kali muraticum, kali natrum muraticum. Relationship, one of the best antidotes for lead poisoning. The skin symptoms are worse in winter, better in summer. This is characteristic of alumina also. If skin symptoms are suppressed, it causes diarrhea, very important modality and alternating symptom. Aggravation is by carriage riding like cocculus and sanicula. Aggravation during thunderstorm like phosphorus. Aggravation in winter like alumina. This remedy has 40 to 50 days of action. This remedy, in boric, it has been not mentioned the complementary, but Ken Mathur has mentioned sepia as a complementary to this remedy. So that is one specific remedy relationship he has mentioned about sepia. Then he has mentioned three antidotes to this remedy. They are cocculus, naxomica, and phosphorus. And this remedy antidotes the nitric acid as well as lead poisoning. So this is a wonderful remedy. One has to understand its depth and can utilize in practice. Specifically in winter season, this remedy one should not forget. My suggestion, look towards the diagnosis also, the palmar and plantar eczemas. And if characteristic features are there, then think about the petroleum. Gastralgia, very important remedy. The diarrhea, chronic diarrhea because of suppressed skin eruption, this is very important remedy. For pregnancy complaints, gastralgia, diarrhea, vomiting, nausea, carriage riding problems, this remedy is a wonderful remedy. So you have finished one more polycrest from third year syllabus. Very important remedy to be asked in skin complaints or eczematous pattern. Even this remedy is very useful in psoriasis because in psoriasis has that typical pattern, that winter aggravation and amelioration during summer. This is the remedy which covers that also. So psoriasis, you can think about the petroleum if the symptoms matches. So we have finished the petroleum. Tomorrow we'll start with one more remedy. We'll learn one more remedy. But tomorrow I don't know exactly whether lecture will be there or not. I will let you know in the evening. So that's all for today. We'll meet again tomorrow. If any queries are there, we'll have a chat. Otherwise, we'll meet tomorrow. And second important thing, that on next Sunday, that is on 21st, I'm there on Gaurang's platform. I'm going to share my experiences with Kent's repertory, with generality chapter, with different cases, and what is the role of generalities in such types of cases. So be there, attend that, and on 1st of September, just I have sent the message. There will be a good seminar by Dr. Gaurang and Dr. Shishir Paranspe in Pune. I will be one of the important panelists over there. So that is also a good opportunity to learn from those youngsters who are having a good knowledge. So if possible, definitely attend that. There was one question, how to approach recurrent tendency to renal calculus. You have to take the detailed case and you have to find it out a remedy, constitutional remedy. Unless and until you treat with constitutional, it is not possible to get the result. The Berberis vulgaris, or if you are prescribing Sarsaparilla, Paraira brava, all those remedies, those are remedies which will work only as a palliative, not curative directly. If you want to stop the tendency, then you have to find it out the constitutional remedy for the patient. So that is the only approach with which you can stop this tendency. Okay. So that's all for today. Thank you and good night. We'll meet again on tomorrow.
Thank you, sir. Good night.
Sir, good night.